welcome to Bite Size Dental Marketing. Today we are going to talk about practice transitions, and we've got the best and the brightest minds on dental marketing there is.
If you are that dentist who just bought a practice, you are trying to transition the practice from the old dentist to yourself, and you're wondering, where do I begin? This is the episode for you. We are going to talk about 4 tips that we believe are the most important things that you need to keep in mind as you're looking forward to your practice transition.
We were at a ACT conference up in Milwaukee, which is a surprisingly lovely city. I love flying in, seeing Lake Michigan and the downtown. Ian complimented that the downtown of Milwaukee is cleaner than Cape Town.
It is.
So Milwaukee 1, Cape Town 0.
And the market there was fantastic. The streets were very clean. The people were lovely. I would like to thank the city of Milwaukee for having us. It was fantastic.
They should probably give you a gold key for that. Like one of those big keys to the city. Yeah. But there we met Jim and Emily.
Correct.
And Jim's a doctor who's transitioning the practice. The practice is in his name. He's transitioning over to Emily, and that prompted us getting together to talk about, there's so many of these happening right now. What's the right way to transition an office, the branding around it, the patient, all of the aspects of how to handle it from a communication and marketing standpoint from a doctor who's looking to retire to a new doctor. Here we are today, folks.
Yeah, so I wanted to start by, getting a clearer picture about this specific circumstance, right? So like, as you said, Jim is older. He is getting closer to retirement. Emily is a younger female dentist. And the goal is to keep the style of the practice in place in the sense that the type of dentistry is going to be done there, the fee structure and all those things. But you have to balance both the continuation of the legacy per se, but also making the practice for all.
And not to scare off the existing patient base. Where a lot of people would go is, I need to redesign the logo immediately, and I'm going to need to redo the website, and I'm going to need to do all of that. Where I encourage doctors to actually start is, how are we going to use the existing dentist as social proof to help me educate my existing patient base that this person that's taking over my practice is an incredible person and somebody that you can trust, just as you would trust me. So internal marketing efforts to start preparing your patient base of what is to come is likely where I would start when it comes to how you're marketing yourself as a dentist.
Now, do you guys feel like the transition itself looks different if it's transitioning from a male doctor to another male doctor about the same age, or if there's an age gap, if there's a gender, if there's a race difference? Like, how do you guys think that impacts the transition?
One of the ways it impacts it for me is if there is a big age gap, that probably means the patient base is older too. And I think there just needs some reassurance. To me, in any scenario, and whether it's more impactful or less needed, it's about reassuring them that they're philosophically aligned in the way they're going to handle treatment. If it's a real high technology practice or it's a lot of things going on, for me, the first piece of the pyramid is laying the foundation that we're philosophically aligned, and I'm really excited for all the great care that you're going to receive from Dr. Emily. I don't know if it changes how to be presented. I think the presentation is still, we are one, and this is a transition that I'm really excited about.
Yeah, I think I can get behind that, Eric, as long as we set the criteria up front that this was in fact a culturally aligned transition, right? Because that's not always the case. We're establishing also that this isn't a hostile takeover, is not the right word, but there are certain scenarios where you buy it
not
and
putting someone out the pasture. Yeah.
Right. Like, or that the next day you come to work and the old doctor is like, I'm out of here. Bye. Right. So I think if we put those aside for today's conversation, I think I can get behind that. So, all right. So we have 2 doctors. They are culturally aligned. They want to be communicating with the patients. The quality of the care and the philosophy, the approach is going to stay the same. That's point number 1.
And the best way to get somebody or the existing patient's trust is transparency and bringing them along the journey, explaining, hey, this is why the old doctor is choosing to transition, and this is why we're bringing in the new person, and making them feel like they were part of the decision and the journey all along, rather than packaging up and just informing them at the very end. It feels very different when they are brought in the journey as the transition is happening.
And there's ways that I've seen you can do this from, as you said, Saurya, starting early, even when I'm still around and the new associate is in the office, to start saying, hey, do you know that, like in this case, do you know Emily's going to be taking over from me starting next year? Have you guys met each other? Just those first introductions. And then as you get further down this path, to start thinking about things like, let's say it's patients that have not been to the office in a while and you want to reactivate them. Are we creating a video of the two dentists side by side and we're shipping that off? We're sending it out to our existing patient base. Just ways to trickle in to start seeing the doctors together, because that's the most important thing that I've at least seen is we need to see these two individuals together so that that trust aspect is there before it's kind of just remove one, replace the other one, and then we must act like the patients are not going to have some kind of confusion when it comes to the end of the day. So this is a journey that I want you to take together in educating these patients.
I've seen some of these where the transitioning doctor is so hesitant to talk to his staff and so hesitant to talk to his patients. And the truth of the matter is, I mean, if somewhere someone knows I'm not going to work forever, and whether it's next month or in 10 years, it's a conversation to be had. And I just don't believe it's something that we should shy away from. Talking to your staff and talking to the patients that look, I've taken great pains to make sure that you're going to be well cared for. I think that leaves a wonderful legacy and makes it look like you had your stuff together. And I think it's noble. But I like all the things that you're saying in making sure that we're bringing the patients and the team along for the journey, because one of the things I'd want as the incoming doctors, while I know there may be some misalignment in the way I ran office versus the next person, I do want to keep the bulk of the staff for some period of time happy, because the patients are continuing to see them, and I need to invest some time in bringing the staff along as well, because they can sure make a transition difficult as well if they're not aligned.
Yeah. So what I'm hearing then is that the first step on this journey transition is, assuming that you've already established that you are culturally and philosophically aligned, is communicating to the patients that, in fact, the quality of the care, the approach, the philosophy is going to stay the same. You guys are two peas in the pod, so to speak. Number two sounds like it's communicating and bringing people on the journey, the existing patients, new patients, the team, so that everyone can be excited about it and know that this is coming as early as possible. I think for me, the next one, and I'm curious what you guys think on this, is I feel like inherently people are always asking that question, what is in it for me? So I think there's this element of, as I'm bringing a new doctor, I have to be able to articulate how things are going to get better for that patient. Maybe as a new doctor brings some new skills to the practice that the old one didn't have. Maybe it's how there'll be more availability on the schedule. Maybe we're opening some extra hours or some extra days. Maybe it's just, how does this benefit the patient? Because I think without that, most people don't like change, and they default to wanting to continue to see the old doctor just because that's who they're comfortable with. So you have to sell the benefit. So for me, when I think about a transition, I think of it in three phases. Phase one is sort of like what Ian said. I tell clients, imagine that I'm taking the old doctor and like rubbing it on the new doctor. I want all the goodwill, all the legacy, like just the good feelings and that emotion. I want the old doctor to vouch for the new doctor and talk about, I want Jim in this example to be talking about how he hand selected Emily. He waited for a long time for the right doctor because it was really important to him that his patients got really taken care of. So phase one, it's that the joint, these two people are really aligned. I think phase two is you have to show how Emily, in this case, the new doctor, is bringing something extra to the table so that people feel excited about her. And I think phase three for me is you have to show them that they can stand on their own. Because what happens otherwise is it can look as if the new doctor needs the old doctor as a crutch. And like you said, we know that day is coming where they're not going to be there. So after you establish that trust and the comfort, you have to start showing the new doctor on their own, engaging with patients, doing content for, educational content, having their own Google reviews, having them being highlighted on the website a bit more prominently so that it becomes really clear this is our future for the practice. And we can still honor the past, but we have to start looking forward.
To that point, it's like what you were saying, Andre. I wanted to close the loop there. I think with a new doctor, obviously the brand is getting an elevation. We're now having to elevate and rethink the brand so it fits the new doctor, and not just think about the existing patients, but also who are the new patients or the target market that would resonate with this new doctor, and think about that and make changes to the brand appearance of the practice to cater to those people and the new pool of people.
Because too, that actually brings me to my question for both of you now, because seeing as you close the loop on Andres and I see. I'm Emily, I'm saying, okay, well, you guys are telling me how I need to say these to the patient stuff, but the building still has the existing dentist name on, brand free. Where do I start? I need to now rebrand. I need to look, what do I need to look at as this dentist that's taking it over? So Saurya, where would you start in terms of your brand? I know there's the website, there's a Google business, the logo, all of that. So where does it start for you on this journey of changing this brand so that people see this person that you just said that doesn't have to depend on the previous dentist?
I think digitally, it would definitely start by featuring the doctor, like Andre said earlier, on their Google My Business, on the website, on socials, making the transition the elephant in the room that has been addressed really well. So hopefully that the new doctor's name is already visible and existing out there along with the old doctor. And the reason I say starting digitally first is because those are things that are more low-hanging fruit. They're easier and faster that can be done, rather than the signage that's on the building, which may take a little bit longer. And if you've properly communicated to the existing patients, then the signage on the building shouldn't be a whole lot of an issue. And we don't have, besides some specific areas where they do attract foot traffic, that's usually not where people get most of their new patients in this day and age. So definitely starting on Google My Business website and the owned media, so to speak, of the practice of their brand. That is where I would start updating the name of the doctor and eventually slowly phasing the old doctor out.
From there, I would schedule an appointment like a new patient and find the way the voicemail, the appointment confirmations, the missed appointment emails, all of the accompanying things also have to be looked at once you get that in place. And I like it when they answer the phone. Hey, this is the office of Dr. Jim, soon to be Dr. Emily, and we're so excited. And then after the transition is made, I like answering it. This is the office of Dr. Emily, previously Dr. Jim. We're so excited to welcome you back. But I believe that there needs to be, and Andre alluded to it, and Saurya just alluded to it, there needs to be some balance. I'm not pushing the old doctor out. I am, however, doing it with purpose and respectfully. At some point, this is Dr. Emily's office, and it needs to reflect Dr. Emily's name across the spectrum. And the office needs to be excited about it when they're on the phone with patients and when they're confirming appointments. And it needs to be very well presented to the patients at every touch point.
Communication keeps coming up, communication. Yeah. I know they'd spoken about that at Act Dental too over the past week. Just how are you communicating? And that's every theme of what each of you are saying is like, how are you communicating this message?
Now, in terms of timeline, there's a question that I get regularly, what's the time frame for all this? Is this a 3-month transition, 6 months, and 18 months?
It's as long as it needs to be. For me, there are events around it that dictate the timing. So to me, the timing is less about I have 16 months or I have 8 months. There's probably some factor at play here, right? Either the practice can't support 2 doctors, so the old doctor's having to transition out sooner. There may be a health event. There may be, something at play. Ideally, you should go as long as you have time, and that way you can co-diagnose sometimes. You can, gosh, Dr. Saurya is going to take care of you today, but next time you're going to be in my chair, and I'm so excited. I obviously like a longer transition. It is more costly because you're feeding two people from the same practice, which is sometimes challenging. I think it can be done very quickly, but with that comes some risk of how many touch points are you having with each patient to nurture them along and make them feel like they're part of the journey becomes a challenge.
What if I have 6 months, Eric? And actually, to all of you, if I say, because at least the conversation I'd had with them, it doesn't sound like there's a ton of time left. Like he had said, I think it was at the start of next year somewhere. But let's, for the sake of the exercise, you have 6 months. Where am I starting? Sorry, pain free. I don't have that much time. Where am I starting? I have 6 months.
You're starting with your internal patients, making sure that you're doing the hygiene checks together, making sure that you're co-diagnosing treatment, that you're, all the things that you should be doing anyway in that 6 months. And I think in that time, you're going to have to do point number 1 and point number 2, which is start working on your vision of the practice and start making changes to the lobby or the waiting room that you want. Start changing the way we answer the phone, soon to be new doctor. To me, it's taking point number 1 and making sure that you're communicating it out to every single patient at every single touch point. Every time the hygienist confirm appointment, hey, just so you know, you're going to get this appointment reminder. It's going to be under Dr. New Doctor. And we're so excited. She's so amazing. And ACT does this thing that I like, the intentionality of when you're talking about a coworker doing it almost over the top of like, you are going to love Dr. Emily. She is so amazing. I just love the way she does hygiene checks and how the quality of her dentistry. And I'm so excited to have her in the practice. I think that needs to be drilled into the team to be really excited about the transition.
What you said reminds me, Eric, of this one time where we heard this example from one of the offices where a new doctor had joined or taken over the practice, and on the phone, when the existing patient was asking about the old doctor, the person who answered the phone responds with, "Oh, I'm sorry. Yeah, she doesn't work here anymore. The new doctor is just as good." That doesn't inspire confidence on the new doctor. That's not excitement. That's not building the doctor up. We're not talking about anything that the new doctor is bringing in, the benefits of having them here. We're saying, well, they're just as good. So I'm sorry that. So the language and how the team within the practice responds and reacts and is interacting with this information makes a huge difference.
Yeah, I think what that brings up for me, Sarah, is, obviously we're a marketing company, so a lot of the things we're talking about are related to marketing. And when people think about marketing, they think about when should I change the name, and when should I change the logo, and when should I change the website. But that feeling that you talked about and that Eric talked about in terms of the team being excited comes from the culture side of the practice, right? It's hard for the team to feel excited if they feel uncertain if their jobs are at risk, if this new doctor is going to continue some of the way that the old doctor ran the business. We do see this regularly, not because it's our wheelhouse, just because we become friends with our clients, where a new doctor takes over the practice and they change about paying for scrubs or something small, but then the team gets really worked up about it, and it creates some negative feelings about the new doctor because everything is changing. And so there's also this balancing act of you got to make the practice yours. Things have to change. You can't keep everything the same for the comfort of the team, but also doing it in a way where people see where you're going with their practice and how it's going to benefit the team itself long term, and how we're the type of culture that we're trying to create, so that in those touch points with the patients, they're genuinely excited about the new doctor, not just repeating words that were told that they had to repeat. And that's marketing, right? Because from every phone call is marketing. Every engagement with the patient at chairside or at the the checkout or any of those places, that's marketing too, because you're creating part of the patient experience.
We're people, we like to talk in terms of when do I update Google Business. It really, the risks we see or the transitions that don't go as well, very few go bad. It is almost inevitably the culture of the new doctor runs the practice so different that it creates some disjointedness in the staff. that shows in the patient experience.
So to recap everything that we talked about today, first and foremost, we talked about communicating the cultural alignment between the two doctors. The old doctor needs to communicate with the existing patients around why this new doctor is aligned with them culturally, philosophically. We need to essentially do everything we can to rub off the credibility and the goodwill of the old doctor onto the new doctor. And that comes from talking about the new doctor, seeing them together, imageries of them together, videos of them together. And that goes hand in hand with clear communication to the existing patients, being very transparent and bringing them along the journey, making them feel like they were part of the decision. They know everything there is to know about this transition. And that leads me to our third point, which was communicate what's in it for the patients. What is the new doctor bringing to the practice? What does that mean for them? All of the great, amazing things and the skills that the new doctor is bringing to the practice needs to be communicated. And that can come in different videos about the new doctor or finding different tactical ways to incorporate the new doctor into the branding of the practice. And I think the next thing, which was one of the most important things that we talked about, is making sure that the internal team is excited about the new doctor, making sure that the new doctor is immersed into the culture of the practice. We're talking about the doctor in a positive light and feeling excited and communicating that to the patients.
Then you can have a plan for how to change the marketing and update your site, update the Google business profiles, change the Facebook and Instagram profiles, things like that. And those get a lot of play, but I think those first 3 points, be culturally aligned, the clear communication of we're in this together, and then making sure the doctor is well represented and that positive priming we were talking about is precursors to getting the marketing changed.
All right.
Well, that was your bite of internal transition dental marketing.
Thank you.
Thank you.